I was in Pompeii early this year. Pompeii near Napoli is like traveling through time. It's a fascinating place. So basically there was a volcano nearby. The volcano exploded and the whole town was suddenly buried with all this ash and things from the volcano. So as the scientists and archaeologists started, digging there, here's this, super well conserved city that suddenly somebody put pause, in time. I mean, there's other old places and so forth, but then other people came and fixed things and changed things. No, this one is exactly as it was back then. It's exactly there. So walking those streets is very interesting. You can see the houses of the well-to-do people. They're nice and big. You can see the houses of the people with less economic resources. You can see the art of the people that were living there. And there's actually quite a lot of, this happened before Christianity came to that area. There's actually quite a lot of immorality in the whole town. And in fact, when the first archaeologists started digging there, they thought they had found Sodom and Gomorrah. So much immorality that is around there. And then something that happened to that town, there was this super hot current that came to town, and that's what killed most of the people. So most of the people died in this type of position because their muscles were in contraction from the severe heat. And scientists figure out that if they inject this material made out of calcium in the holes that were left by those bodies, after they remove the ash, you could actually see the exact bodies. And as you can clearly see in this picture, even the clothes that they were wearing and all these little details were, being able to maintain for so many years. This is something very, very interesting. They haven't finished the whole town, so they still continue to dig and find all kinds of new things in the Napoli area. And of course, if you go to Italy, you have to eat pizza. So there was this place there where there was this really, really good pizzas. In fact, they were so good, I had to freeze some of them and bring them to America, on my way back. Because, I wish I could do pizzas as good as those there in America. And actually quite affordable, those pizzas that you can find there. Reminder, the topics that we are covering here, the handout is this Pandemic Busters. There still is a few books left. So as you go on the pause or at the end of the program, you can go ahead and see Katie. She has those books. And the book is written as an infographic. That's the way that the book is written. And reminder, my research is found on that ResearchGate page. Just put in Google Francisco Ramirez ResearchGate. You should be able to get there. There's also my Twitter account, as well as a YouTube page and Instagram. If you want to, see many of the studies that I'm mentioning, most of them are there, especially on the Twitter account. You can find the original ones there and read not only the study, but usually I put a press release there together with them. So let's talk about the good news about cancer. This is one of the most feared diseases for my patients. In fact, there's patients that they don't even like to hear the word cancer. They think that somehow if you say that word, they're going to get it. That's how afraid they are of this disease. So that's why sometimes we refer to this disease as the C disease. We actually don't say the word so that the patient doesn't, get afraid of it and so forth. And the reality is that the cancer numbers are increasing worldwide. And This is a sad reality of the world that we live in. Part of the problem has to do with the aging population, but also has to do that our lifestyle gets worse and worse with time. You know, all these fast food places, lack of activity, stress, alcohol, and so forth. The statistics say that if you live the average lifestyle, 1 out of 2 men will get it, and 1 out of 3 females will get it. That's why I'm very glad you guys are here tonight, because you're going to be learning how you can decrease those odds regarding this. So there are 7 warning signs that we need to know. And these ones are something that you need to learn. Now, these warning signs, they don't mean that you have cancer, but they do mean, if any of them are present, that you need to make an appointment with your GP so that you can check and make sure that everything is okay. Not only cancer gives the symptoms, but we start thinking about something along those lines if we find any of them. So here are the cancer warning signs. Again, it doesn't mean you have cancer. It means we need to check those symptoms to discard the problem. Number 1, a change in bowel or bladder habits. So this is what happens, especially the reason why you may get the symptom, especially things like your colon, as a cancer can grow there. Well, it will change, the diameter of the organ, so you may start seeing changes in the diameter of the feces that you're passing. That's the reason why something like this could happen. 2, a sore that does not heal. Watch out for this. Again, this doesn't mean it's cancer. For example, a diabetic, they can sometimes get these ulcers, especially in their feet, and especially if their glucose control is not good, it's going to take, a long time for that to heal. But it's a good idea to go and show your GP, look, I have this sore here, my mouth and in my skin and so forth. Can you check this? And there's multiple tests we can run to try to make sure that everything is okay. 3, unusual bleeding or discharge. Okay? You have some sort of sore, and the thing keeps on bleeding and bleeding and bleeding, or is discharging stuff for many weeks. You want to go ahead and check that. That's not something that we can consider something normal. Thickening of a lump in the breast or elsewhere. This is very sad. I've seen this too many times. For example, a relative of mine had a little lump that she started feeling in her breast, and she didn't do anything. The thing continued to grow to about a size of a golf ball. She didn't do anything. The thing continued to grow to a baseball size, and still she didn't do anything. Not until that thing was the size of a softball. If you know softball, it's about this size. That's when she went to see the doctor. Sadly, it was too late. That cancer had already grown and had metastasized and so forth. Don't wait. Do your appointment and deal with it. I have some patients that says, well, doctor, but I'm afraid. What if it's cancer? Well, it's better to know if it's cancer right now than 2 years later. Because the more you wait, the more this thing can grow and so forth. Another one, indigestion or difficult in swallowing.
What does metastasize mean?
Metastasize means that the cancer starts moving somewhere else. So yeah, you do not want, metastasis. And we'll see about a little interesting study. I'll show you how to decrease that risk of metastasis. So yeah, excellent question. Next one, indigestion or difficulty in swallowing. This one has to do with cancers of the throat, of the esophagus. It actually doesn't mean that it's cancer. It could be something else, sometimes an injury, sometimes a scar, other things could potentially give that. But especially cancers like the esophagus, you think about it, if there's something growing there, as you're trying to pass food, well, things get stuck there. That's the reason why this potential symptom may appear. And this other one, again, this is also another one sad that I've seen too many sad stories about this, that the person doesn't take care correctly. Obvious change in a wart or a mole. You have something there in your face, in your neck, in your chest, in your back. And the thing starts changing, starts growing in size, sometimes starts releasing certain things. You need to go and check this thing. Especially you guys, Australians, you guys, you probably have heard about this ozone hole that you guys have here. So, more UV rays get and so forth. So that extra exposure from the UV lights, can potentially create most changes. Also, for some of you, your genetics are not the best for that. In dermatology, we say that white skin gives increased risk for skin problems. Okay, so especially if you're white skin, watch out for that. Doesn't mean you cannot go to the sun and so forth. It doesn't mean you need to be more careful, regarding sores and things like that. Have somebody that I know started with a sore in his upper back. He knew he was there. This mole, the thing started growing and growing. He didn't do anything. Not until the thing was like quite big, that's when he showed up on the doctor's office. The thing had already metastasized. The thing had already moved somewhere else. And skin cancers are actually some of the easiest to deal with at the beginning stages. Just cut the thing off, and it's over, But if you leave it there, the thing starts growing and the things can start going inside, and then you're going to be in really big trouble. Don't wait. And nagging cough or hoarseness, this cough and cough and cough and cough and cough. Sometimes people that have smoked for a long time may have this, and that doesn't mean it's cancer, But sometimes this coughing, may be an indication of something else. Again, any of these symptoms do not mean you automatically have cancer. It means you need to go and check with your physician to make sure that everything is okay. Now, let me show you this fascinating published study. So in this study, what they did, they took cancer cells and they put these cancer cells in what is called a Petri dish, this little, thing made out of glass. And they took blood from somebody that was eating the standard American diet, which is, as you're aware, not the best diet. There's a reason why in its abbreviation we call it the SAD diet. Because it is a very sad diet, that standard American diet. So even that is going to have some immunity. There's still some immune cells and so forth. So when they put those cancer cells, even the standard American diet was able to decrease by 9% the cancer cells. So some of the cells there in the immune system were able to go and attack that cancer. Now, somebody following a whole food, plant-based diet for 2 weeks, when they took the blood from this person and injected that into that Petri dish, that blood was able to eliminate 70% of those cancer cells. That good news or bad news? That's great news, isn't it? how just the change in diet started tremendously activating the immune system. In fact, they even had images of that. So you see here the before and the after. So the way they do this, the cancer grows as a film, and then when you inject this thing, it starts killing those cells of the cancer. So you can see the before and then the after. Here's the before, and this is after. Look at that. That's the only remnants of that cancer that occur. So as you can see, there's a big difference between following the standard American diet and a whole food plant-based diet. So the reality is that there's many factors that can help us. You saw one of them, that whole food plant-based diet, especially if there's family history, you had other relatives that had cancer and so forth, it will be a really good idea to follow that diet. Also, stress can be good for you. Stress in a balanced way. See, it's interesting, too little stress is not good for you. Too much stress is not good for you. You need a balance in your stress. In this very interesting study, they had people that were experiencing what is called passive stress. They put them to watch some scary movie, and the other one was active stress. These people were, busy, trying to meet some sort of deadline and so forth. So they had these 30 volunteers, 18 to 34, that were exposed, to those two different types of stressful situation. Now, when the active stress happened, the one that had the deadline, those volunteers were asked to memorize information, and then they gave them a little test to see how well they were remembering. And the passive stressful event, and then they did that, the same video and so forth. So during the experiments, each person gave saliva samples so that they can test, how the immune system is doing regarding that. And those components of the immune cell are protecting the body against cancers, against bacteria, against virus, some of the things that they were measuring. And those secretory proteins actually increase during the active stress. Interesting, isn't it? And it's interesting that those components that are protective actually drop during the passive stress. So in other words, the people that had that a little bit higher level of stress, their immune system was doing even better. Fascinating, isn't it? So as I've been telling you in the past, retirement is not very good for your health, So you need to find yourself to do something that keeps busy and so forth. So in the published paper, this is what they reported. Stress is not the big bad thing everybody's thinking it is. In fact, most acute stressors actually boost the immune system. Only when the stress is unusually prolonged or repetitive, it becomes a potential threat to health. So you can see here in the graphic, here it is. So the way to optimize your immune system, you need to be doing something meaningful and be yourself busy. That is when we are in the very high level there. Now, if it is too much, too long, too often, that can be problematic. Somebody at home, may not be well in their relationship with their spouse and so forth. That's constant stress. That's not good. That's going to take your immune system down. But at the same time, if the pressure of stress is too low, that's going to have actually a negative effect also. So you need to find that right balance. So in other words, don't just sit down in front of the television and not do anything at home, Volunteer yourself, do something, to be able to have some meaningful interactions that is going to be good for your health. Another thing that they found out is that regarding cancer, if we can add exercise with the diet, there is a synergetic effect. In other words, both of them come together and the positive impact is even better. So, as you can see, we've been talking about multiple factors. In fact, yesterday, isn't it, we talked about exercise and how it activates the immune system and so forth. Well, if you add the right diet to the right amount of exercise, you optimize the ability of the body to destroy those cancer cells. And this is the thing why this is important. See, every day, all of us generate cancer cells. So the reason why you don't end up with the cancer is because your immune system is able to destroy those cancer cells that are being generated every day. So by having that good lifestyle, you can see that synergetic effect that can help you protect against cancer. Other things that could have a negative effect is sleep. Sleep, when you are sleeping deeply, that is when you have the optimum function of your immune system. So don't compromise your sleep. And you can see here in this interesting experiment, they had these young people, university-age people, and just 1 week of sleeping less than 6 hours a night was enough to start activating genes that bring disease. Now, the opposite can happen with exercise. When you do exercise in this particular study, just 20 minutes of exercise. I mean, that's not that much, isn't it? I mean, in fact, in my opinion, you should be doing a little bit more than that. But if you can just at least do 20 minutes of exercise, 20 minutes of exercise started activating those health genes in the body. In fact, not only that, you actually can have a positive effect on your inheritance. In this interesting study, they found out that fathers that are fathers-to-be that have a regular exercise program, their children are smarter. So the fact that you're doing exercise, you start activating all these good things in your genes background. So disease never comes without a cause. The way is prepared, and disease invited by what? Disregard of the laws of health. So that's why I'm very glad that you guys are here tonight, because we are learning about those laws of health. It's like when you go to another country and you need to do something like driving and so forth. Something that may be allowed in your country may not be allowed there. And if the police comes and you say, well, it's because I don't know the laws of Australia, it doesn't matter. Here's your ticket, isn't it? Boom. The same thing happens. You may be ignorant of the laws of health and maybe violating them, you're going to get in trouble. So I'm glad that you're here tonight as we learn more about those laws of health. And look at this. This is a very insightful study. So in this study, they had these 3 different groups. They had Japanese people living in Japan. Japanese because of their lifestyle, and especially this study that was done back in the 1990s, they tend to have lower rates of cancer compared to America. And then Japanese that moved to Hawaii, you see those on green. Japanese love Hawaii. There's a lot of Japanese in Hawaii. And then white people living in Hawaii. For the record, Hawaii, as you're aware, is part of America. So they follow the American lifestyle. Now, these are different types of cancer incidences, that the cancers that you're finding. Now, from all those cancers, which one look alike more? The Japanese in Japan and the ones in Hawaii, or the ones in the white people in Hawaii and the Japanese? Which parts do they look alike? The pattern is very clear, isn't it? How the Japanese that moved to Hawaii, their cancer rates started increasing just like the white people that live in Hawaii. Why is that? Well, they start acquiring those habits, Once you see you have this McDonald's there every block, it's easy to start, getting that type of food and so forth. Now, the pattern changes, if you notice there, regarding that stomach cancer and esophageal cancer, much more higher in Japanese in Japan. And the reason being is two factors. Number one, alcohol. Japanese people use a lot of alcohol, and alcohol is carcinogenic, as we're going to see in a minute. And number two, smoke products. They like a lot this smoked fish and so forth. That's also not the best for your body. So we know that in order to happen cancer, we need to have something called inflammation. And this inflammation happens when we have bad habits. In the long term, our body enters into what is called a chronically inflamed state, and that is preparing the ground for cancer to sprout. That's why I don't want to have that chronic inflammation in the long term. In fact, somebody this morning was asking me, Doctor, I'm going to go to see, my physician. What laboratories should I ask for? I told him one of them that you need to ask for is the marker for chronic inflammation. That marker is called the CPR, or C-reactive protein, CRP. And there's two CRPs. There's one that is just very general, and there's another one that is called ultra sensitive. So you want to know your ultra sensitive C-reactive protein. And when they give you the result, the number you want to see a number less than 1. That you're doing good if that test shows you a number less than 1. Because this is a reality. I want you to see something. In the bottom, you can see the different types of cancers. And before it was a cancer, it was inflammation. The word itis at the end, cervicitis, colitis, pancreatitis. Itis means inflammation. So please notice that before it was a cancer, it was an itis. So we want to solve inflammation as soon as possible, because fooling around with this inflammation can get you in trouble. And then in the very top, you can see some of the factors that could potentially trigger that chronic inflammation. Many of those things are things we can do something about it. I see there's smoking. Can you stop smoking? Is that possible? Yes, it's possible. High-fat diet. Can you change your diet? Yes, it's possible. Alcohol, I see there. Can you stop drinking? It's possible to do that. So, this is what happens when your body needs certain amount of inflammation just to do its everyday functions. Where I live, as they were interviewing me at the beginning of the program, where I live, it can get cold there. We can get some snow and so forth. So you need to have some sort of heater there. If not, you cannot survive. It's just too cold for the winter. So as long as the fire stays inside there, everybody is nice and happy. But if the fire comes out of there, I'm going to be in trouble. That's the way I want you to think about chronic inflammation. So, normal inflammation levels, the left side. You need certain level of inflammation. That's why when you do your That test that I told you is not going to show you 0. If you had 0, we get in trouble. We worry. That's not normal to have 0 inflammation in the body. But you need to have it less than 1. More than 1, it means the fire starting to creep outside of the fireplace. We need to stop that, because if we keep that long term, man, very soon the curtains and things can start getting on fire, and you're going to get yourself in trouble. So as soon as possible, we want to control that inflammation. Among some of the common things that cause inflammation include cigarette smoking, alcohol, excessive ultraviolet light. And you can see how alcohol affects very much multiple organs in your body. Here is an image of a brain. We're seeing the brain from the bottom up. And you can see here what happens when you are drinking alcohol for 17 years. There's not a hole in the brain, but the function areas of that brain are being affected. That, by the way, if you stop, some regeneration to a certain level can take place. So the sooner you stop it, the better. And you can see how, see that NF-kappa B in the very center? That is the master switch of inflammation in the body. In other words, when that NF-kappa B is active, you are going to have chronic inflammation. That's basically what it means. Now, notice how pretty much most diseases that we see are directly related to that chronic inflammation. That's why you need to control that chronic inflammation ASAP. So here's the question: is inflammation your friend or your enemy in cancer? Depends. If it is the chronic inflammation, it's your enemy. If it is normal inflammation, it's actually helping you fight that cancer. And the reality is that things like alcohol don't help. Tremendously inflammatory. 75% of all the esophageal cancers directly related to alcohol. 50% of all the mouth cancers, 50% of larynx cancers, 30% of all the liver cancers, and it increases the risk for colon and rectal cancer as well as breast cancer. Look at this one. Why the American Cancer Society says to stop drinking. The guidelines have changed. Now we have all the information. By the way, you find all these ones on my Twitter account. Quitting alcohol may improve mental well-being and health-related quality of life, as this other release. And look at the things that happen when somebody drinks alcohol. From shrinking of your brain, increasing your risk of dementia, blackouts, dependence, behavior changes, hallucinations, slurred speech, liver damage, pancreas. Remember that itis? What does it mean? Inflammation, pancreatitis, diarrhea, infertility, lung infections, fatigue, stomach distress, birth defects, malnutrition, diabetes, numbness, thinning of bones, changes in coordination, muscle cramps. All over the body is affected due to alcohol. This is a published paper. This is the title of the scientific paper. A bottle of wine has the cancer-causing potential of 5 to 10 cigarettes. I mean, we know that cigarettes are no good, isn't it? Well, by partaking of alcohol, you are increasing your risk of cancer. Even light alcohol consumption is linked to higher cancer risk in this study that was done in Japan. And look at what Harvard is doing. Harvard $39 billion endowment is reportedly buying up California's vineyards. So this is where, Harvard is investing their money. Smoking and drinking can damage arteries very early in life. Why? Because both of them are very inflammatory. This is from the Sydney newspaper. No safe level. What we're getting wrong with alcohol guidelines. So in the past, they used to say, well, moderate drinking. Have you ever heard of that? It's good for you and the heart. The guidelines have changed. There is not such thing as a safe level. Even one drink increases very much that risk of cancer. Zero tolerance, no safe level of alcohol, says the new study. Alcohol can impair hand-eye coordination after just half a beer, much lower than legal limits. Alcohol drinking caused nearly 17,000 cases of cancer in the UK. Alcohol increases risk for cardiovascular disease. In this one, alcohol must be recognized as a drug. And this is a scientific study. Alcohol must be recognized as a carcinogen. Things that are carcinogen are things that we know cause cancer. Americans are drinking themselves to death at record rates. Any amount of alcohol consumption is harmful to the brain, finds study. Alcohol is killing more people than the opioid epidemic. Why are we not talking about it? Because it's not something very popular, isn't it, to talk about these things. Drinking alcohol makes you older at the cellular level. And this one, it's that came out in the journal Lancet Oncology. The consumption of alcohol caused 100,000 cancer on moderate drinkers. Frontal lobe damage from alcohol may occur before general mental status changes. Heavy teenage drinking is linked to abnormal brain development. How, and this is the title of the scientific article, how alcohol industry organizations misled the public about alcohol and cancer. See, the alcohol companies spend a lot of money so that you don't hear this message in the press and so forth. Okay? So this is such an important information for you to know. This guy from The Guardian, the newspaper in England, I'm surprised how happy I am after giving up alcohol. Because he was messing around with his neurochemistry. So once you remove that, your neurochemistry can thrive, your mental health can improve, and so forth. IQ research prompts warning over drinking alcohol during pregnancy. The alcohol over pregnancy causes many problems, including the decrease of the IQ of that baby. Alcohol causes significant harm to those other than the drinker. And those people can testify of that. Living with somebody, that is using the alcohol and so forth can be quite challenging and stressful. Maybe moderate drinking is not so good for you after all, says this new study. What is the most dangerous drug? This is the magazine The Economist. Look at that. Way more than heroin and cocaine and methamphetamine and so forth. Alcohol, is tremendously dangerous to the body. And you can see how it actually increases quite a bit of crime. It's the drug that increases the most crime. You can see that on the kind of middle reddish color, in the graphic there. Alcohol is killing more people and younger. The biggest increase are among whom? Women. In the past, women didn't used to drink so much, and now as women are starting to drink much more, we're starting to see, how the statistics are affecting them. So, the American Cancer Society recommends certain screenings, and that's why it's a good idea, to have that, yearly checkup and so forth. And based on your age, the physician is going to recommend you certain screening things, and especially also regarding your family history. You want to, check things and so forth. So, things that are, the good news is that most cancer deaths are prevented before cancer even forms to begin with. So by knowing and avoiding those carcinogens, and by boosting and maintaining the immune system. So as you can see, there is a lot that we can do to start making those proper changes. Let's stop that inflammation that we were talking about by eliminating the alcohol, by having our regular sleep, by switching our diet, by doing our regular exercise, and having what is called a temperate living. Not excessive, things, not neglecting all the other good behaviors. In that way, we can start changing the odds so that we can win that battle against that C disease. So we're going to have a little break of 10 minutes. So if you guys want to go to the next room, they have some refreshments there, and we'll continue the seminar in 10 minutes. Thank you very much.